Hi, I'm Yolanda, and today I'm talking about our stick-on wounds. They all come with an adhesive backing, so you can apply them directly onto your skin or that of your mannequin. Now, it's always smart to use a little bit of isopropyl alcohol wipe before adhering anything to a mannequin or to your skin, as it may excrete some oils. So using a little bit of iso there, and by gently peeling off our wounds and applying it directly onto the mannequin, blending away the edges by gently pressing, and instantly we have our trauma applied. Now, over time, you might find that the stickiness of our stick-on wounds might disappear. You can definitely clean them and the stickiness might come back. However, we also have our FX glue gel now coming in a very handy syringe. All we need to do is use a little bit of boiling water, place it in a cup, and insert our syringe. Always smart to clean the skin of your standardized patient as well before applying any of our stick-on wounds. It takes approximately 2 minutes for the syringe to be workable. We use the back of our wound and we drizzle some of our glue gel on that. The glue is made out of a gelatin base, so it's easy to remove with water and a little bit of soap. It's pretty good to use straight away. Of course, the heat of the skin and the body will keep the glue a little bit soft. However, it is very sticky, so it will stay put. And we can do the same on our mannequin. So we can either apply it directly onto our mannequin. However, I prefer to put it on our wounds. So again, it's a gentle little squirt. Don't forget the edges. And we pop it on. There it goes.
Adding the FX gel to our stick-on wounds is a great idea as it keeps the wound itself stable while our participants are treating said wounds. So in this example, I'm going to be reasonably rough in wiping off some of this extra moulage we've got here. So as you can see, I'm pressing reasonably firmly and the wound itself isn't moving around. So it's great to have that on. You can even use some standard dressings on the moulaged wounds. However, I wouldn't use things like a tegaderm, like the clear film dressings, as they might either not adhere to the wound itself or end up peeling the wound off. So at the end of your scenario, once your participants have left or the training's over, just removing the dressing afterwards. Just be cautious, making sure that you don't tear the edges of our stick-on wound there. So as you saw when I removed the dressing itself, the wound managed to stay on the mannequin incredibly well, even though I was using quite an adhesive dressing. So for training like wound dressing changes, that kind of thing in the sort of nursing skills, having the glue gel underneath is a really good idea to ensure that the wound itself is nice and stable. Removing the wound after the scenario, just find an edge, gently peel, so you can gently peel back, and it will reveal the glue underneath. There we go. I'm just going to pop that up there out of the way for a minute. It will be quite tacky, such is the nature of it. However, this is just a piece of green gauze. and it wipes off reasonably clean. Using a cloth with some hot water on and maybe a little bit of soap really helps get this gelatin-based product off.